how can this condition be treated? The good news is that if the disease is detected early and appropriate treatment is instituted, treatment can be achieved. But for now, chronic kidney disease does not have cure, but it can be managed, it can be controlled. And when it is being controlled, we can also help to reduce the disease progression and control the disease process. And this can help you to come down with a better outcome. So it's very important you understand these things I'm talking about. Don't joke with your kidneys. Don't play lightly with your kidneys. How do doctors treat your chronic kidney disease? Now, it's very simple. Usually, chronic kidney disease in the early stages, they are usually asymptomatic. But in the later stages, when you start experiencing the symptoms, it can be managed. First of all, there are two ways to manage this chronic kidney disease, either by lifestyle modifications or lifestyle adjustments and medications that will help to relieve you of your symptoms and reduce your disease progression, and also medications that will control the underlying risk factors such as your glucose, your sugar, and your blood pressure. Now, for the lifestyle adjustments you need to undertake include: you eat a diet that is less in salt, what we call low salt diet, low protein diet. You don't eat red meat. You avoid eating of red meat. You avoid drinking of alcohol and cigarette smoking. You eat more fruits and vegetables. You ensure you lose weight if you're overweight. You will also ensure that you control your blood pressure and control your blood sugar adequately. That's to say that you must take your sugar medications appropriately and regularly. You must also ensure you take your blood pressure medications regularly and appropriately. These ways you can reduce disease progression. Now, the other medications that your physician might give to you include drugs that will control your blood pressure, which are antihypertensives, anti-diabetic medications that will control your blood sugar, and also drugs that will help to reduce your cholesterol level in your blood, which is anti-lipidemics, and also give you blood that will control your electrolyte derangements. For instance, if you have metabolic acidosis like low bicarbonates, they can correct it, or you have high levels of phosphates, it can be corrected, and if you have low levels of calcium, hypocalcemia, all these things can be corrected. Also remember that supplements such as containing iron can be given to patients to correct anemia, because patients with chronic kidney disease usually have anemia and high blood pressure. So we can give drugs that will control the anemia, such as iron supplements and other drugs. By so doing, you can be able to control this disease process. Remember that chronic kidney disease is not a death sentence, but early detection and treatment will ensure a good outcome. Now, in advanced cases or advanced scenarios, patients with chronic kidney disease may undergo what we call dialysis, either an hemodialysis or a peritoneal dialysis, and also renal transplant. Dialysis is what we call artificial kidney, whereby you be connected to a machine that will take over the function of the kidneys and help to correct those substances, those things that are deranged in your system, such as the toxins and the urea creatinine, to bring the levels to a more lower level. So that's the work of the dialysis. The renal transplant is a surgical procedure whereby you get a donor and you get your kidneys replaced. You get another kidneys from a donor, either a relative of another person, whereby your kidneys you replace your kidney with another one, so therefore your kidneys can now gain its function by the presence of the new kidney. And those who can afford renal transplant are able to live adequate life, normal life like every other human, although they have to be on medications that will help to control so that the organ that has been transplanted do not fail, does not have organ transplant rejection.